Welcome to another highlight of a medical practice that we work with, and we are so happy and we're so proud to go ahead and have One World Healthcare to be part of this program. And we're so blessed to be able to work with all of these awesome medical practitioners and to go ahead and spend time to go ahead and share their expertise not only with us but to community members. So no, this is not their medical practice. We are actually at the senior apartment living, and they're here with us, and we just had a health and wellness fair here to go ahead and reach out to the community members, and we just did blood pressure screening and sugar testing. Now, without further ado, some of you guys already know them. They were from our podcast at Howard Community College before, and here they are again. And we have Dr. Sydney Nelson and Dr. Celia Valero. All right, so. Yeah, thank you. Thanks again for being here.
Thank you for having us. We appreciate it.
All right. So, again, what is it that, what are the typical patients that you guys see at your awesome practice?
Well, we definitely have a primary care / urgent care practice. So we see the bread and butter of medicine. We see your diabetics, hypertension. We help people through their obesity. We also do some urgent care, people coming with asthma exacerbations, bronchitis, stomach bugs, things of that nature. So we kind of take care of many kind of things. Our primary focus is primary care, and so we've been doing that for a little bit now in the area. Okay, sounds good.
And you mentioned about urgent care. Would that include auto accidents as well and work-related injuries?
Yeah, definitely. We do our fair share of back pain assessments. We get a lot of referrals from people that have been in accidents and need a physician to see them and figure out what needs to be the next step in their process. And we send them your way so that they can be thoroughly evaluated for their needs.
And vice versa, because sometimes we'll have go ahead and patients come in and their insurance will go ahead and require certain, like a doctor's referral, and they don't have a primary care physician. Definitely try to go ahead and consider One World Healthcare, and you guys are located at?
We're right there at the Columbia Medical Campus, which is on 5500 Knoll North Drive. That's 5500 Knoll North Drive, and we're in Suite 220.
220. Yes, it's very much accessible. Parking is not an issue. You guys should be good over there. All right. So, Dr. Valero, based on your last name, what other language that you guys know?
I speak Spanish, so any Spanish-speaking patient are more than welcome to come by. I'm going to say it in Spanish too.
Please.
Aquí los pacientes que pues, necesiten ayuda, servicios de medicina primaria, yo soy la doctora Valero Colón y estoy practicando en One World Healthcare, que es en el área de Colombia. Así que pues aquí a la hora, cualquier ayuda que necesiten.
Muchas gracias. Perdón, señorita, habla español un poquito.
No suficiente.
Gracias. All right. So those are the typical patients that you guys go ahead and see, and we try to make this as educational as possible. What are some of the common things that you go ahead and see, and then you go ahead and say, you know what, if you just avoided this, or any other health and wellness tidbit or information that you could go ahead and share to everyone, that would be great. Yeah.
Well, we really pride ourselves on being big on preventive medicine, and I think that's one of the things that you're bringing out. Was preventive medicine is a way for us to keep you healthy and prevent you from having future ills. One big thing is I always tell people at the practice is to know your numbers. So you want to know your blood pressure, you want to know your weight, you want to know your cholesterol, and you want to know your hemoglobin A1C to see if you're at any risk for diabetes. And knowing these numbers helps us kind of cover a broad arrangement of medical illnesses that we know can cause increase what we call morbidity, right? Just when you're just not healthy, and death. Heart attacks are still one of the leading causes of death in the USA. And so by decreasing risk factors, we decrease the chance that someone will have to meet that fate. And so knowing your cholesterol level, because cholesterol leads to atherosclerosis, which leads to coronary disease. Diabetes is a big risk factor for that also. And we all know that obesity is tied tied to many medical problems. So knowing your numbers is all good, and like I said, well, the numbers that we really shoot for, knowing are your blood pressure, your weight, your cholesterol, and your hemoglobin A1C.
Thank you. And obviously, me being in this field, I'm very much familiar with what comorbidity means. But maybe for our listeners or viewers out there, could you kindly simplify comorbidity for us?
Yeah, well, in science we always have these fancy terms, and it's almost like we're speaking a different language. But what comorbidity means is that you have associated problems, basically, and they're medical problems that when they kind of work together can lead to major medical problems like coronary disease or heart attacks. And so comorbidities would be having diabetes or being overweight or being a smoker, things of that nature. Those things there can lead to other problems, and so we want to prevent that.
And I think he mentioned the word prevention or prevent so many times, and that's the key. And with so many of our programs, with our podcasts and other videos like this, is that we focus on the prevention, and as the saying goes, and it's true as it is, an ounce of prevention is better than a pound of cure.
Definitely.
And it's as simple as that. So go ahead and try to go ahead and make sure, visit your medical doctors, and go ahead and visit your medical doctors to go ahead and find out what the numbers are. And of course, if you don't have one yet, please go ahead and reach out to One World Healthcare. Dr. Valero, are you comfortable to share that in Spanish with everything that we just shared?
Bueno, básicamente, pues en la oficina hacemos mucha lo que se llama prevención, no solamente, pues, básicamente saber los números, cómo está tu presión, cómo está tu glucosa, y actuar, si hay algo anormal, pues actuar para prevenir otras enfermedades. Así que, pues, la oficina, pues, hacemos todos los estudios de prevención, hacemos los números básicos, pues, para que la gente sepa en dónde están en cuestión de su salud y cómo pues prevenir otras enfermedades. Básicamente eso fue lo
Thank you. And again, we're just trying to reach out to all the audience out there. Obviously, if that's your comfort zone in terms of language, that's why we're doing this. And okay, now the other thing that I know we talked on our podcast is the telehealth service that you guys provide, right?
Yeah.
Okay. If you guys don't mind sharing that a little bit more, what's telehealth, how you go about it, and
Where telehealth or telemedicine is a way for us as doctors to reach our patients in a very, let's say, easier way. Sometimes we all know that people have busy schedules and it's hard for them to get to the office. And also during this time of year with the flu season, there's a lot of sick people that are coming in, and it's also a way to avoid coming in and exposing yourself to other illnesses. And so telemedicine is a way for us, from our practice, to reach out to our patients via a platform of their phone, an iPad, a laptop, a desktop, and we can give them medical advice and treat them.
okay.
Now, once again, for telemedicine, it's really, when we're doing it this way, we're doing it for non-emergent issues. So these are issues that we can see virtually instead of having kind of physical. But always for emergent issues like stroke symptoms or symptoms of a heart attack, those things you need to report immediately to the ER, call 911 because those are emergencies. We deal in things that are more less emergent, like rashes, diarrheal illness, bronchitis, back pain, things of those natures. Because 90% of diagnosis really, you can get from history. And so we can get that virtually. And once we do that, if we need to make any kind of, orders or things like that, we can do it via our app. And with the app also, we can send prescriptions directly to the pharmacy. So
Prescription using that. Okay,
Yeah.
that's awesome. And again, think about this. Yes, as accessible as they are, but of course, if you need to have a quick check from break from your work or from break from your family life, and you just have a quick question, go ahead and go to One World Healthcare and see if that would be a good option for you. And you mentioned, because sometimes when I did the interview with Mr. Snellgrove, the president of HCGH, that's one of the problems that they have is that they are overburdened in terms of ER issues, and that's why we have these medical practices, such as One World Healthcare, not only accessible from physical point of view, but from telehealth, and they can go ahead and identify as well, if you know what, that's emergency, let's go ahead and call 911 right away, or what have you. But if you're not too sure what it is, see if that's an option first. Is that
Yes,
a good thing
definitely.
to go by? All right, great. Dr. Valero, come on, what else do you want to go ahead and share about telehealth or telemedicine? Is it just here in Colombia, or that's for anybody in this world?
But I think we can do it for everybody in the world, right? Whatever you are, pay it up, you can reach. I mean, you just need to have internet and a camera, and then you're good to go. So,
Alright.
and then, for non-urgent matters, it's two-way communication with us. It's secure, and basically, like, it's just like, we think that it's pretty amazing. So.
And that's a key word there, it's secure. And so, and it's anybody in the world, if you have these questions, if you need to chat with a medical doctor right away, right? This is what technology is about. I mean, we're using these various platforms, this is fine and dandy, but I think we can use all of these platforms for something really meaningful, such as telehealth or telemedicine. So, thank you. All right. Excuse me, anything else that you guys want to share or add?
We actually just want to thank you. You've been very good to us in this community. That's one thing that we've loved about Howard County, is that we've had the ability and expose good people and make good friendships. So we definitely thank you. And we've worked well with you. A lot of our patients that go to you are very happy. It was actually, we were just talking the other day, one of your patients came by with a goodie bag, and we thought that was pretty cool. And so we appreciate that, and that patient definitely is excited about the relationship that they can have with both of us. So first and foremost, thank you for that. But also, we just like everybody to know that, we are community doctors. We're here in the community. We want to make sure that we do our best to make our patients happy. And what that means is that we listen, and that also means that we execute. So we try to do both. And so if there's any other concerns or anything of that nature our patients have, they need to, reach us. They can reach us directly. Once again, we also do the telemedicine, and so that also offers another avenue for our patients to get to us. So.
Sounds good. And to reach you, the phone number would be?
410-730-7040. That's 410-730-7040.
All right, great, thank you. And with everything that he shared, I'm just mirroring it, and these things don't happen, and we're fully aware we don't do everything, and we're fully aware that with complicated situations we need everybody's help. That's why all we do is we just reach out. And we're so thankful that they're reaching back, and that's what it is, because we just want to focus on prevention. We want to focus on your health and wellness, and not only from a sick model that, okay, I'm not sick, then I must be healthy, but no, be as healthy and vibrant as you can be. So again, thank you. I can see there are some people who have joined. I just want to make sure that nobody's asking live questions here and not missing out on anything. I think we're good. To those who are live, we appreciate you joining us. And thank you again.
Yes, thank you.
All right, thank you.
Happy fall to
Thank
you.
you.
All right, happy fall. All right. So for next agenda, so just go ahead and listen in and watch out for all these other programs that we have here to go ahead and highlight all the awesome medical doctors that we have here. Dr. Nelson identified that we're so blessed to be here in Howard County, but they're breaking the boundaries again with telehealth and telemedicine. So go ahead and check that out as well. All right. Thank you, everyone, and have an awesome day.